In this video, we will discuss the clinical presentation of pernicious anemia. It is characteristically insidious. This means it develops slowly and quietly over a prolonged period without dramatic or sudden onset. The red blood cell count can drop to extremely low levels before the patient becomes significantly symptomatic. In older individuals especially, there may be a lengthy subclinical period during which the disease is progressing but clinical manifestations remain minimal. This is why pernicious anemia is frequently diagnosed late. When the disease does produce symptoms and signs, several characteristic findings emerge. The skin takes on a distinctive lemon-yellow color. This is not purely jaundice and not purely pallor. It's a combination of both. The pallor comes from the anemia itself, and the yellowish tinge comes from mild hyperbilirubinemia, resulting from the intramedullary destruction of red cell precursors. Ineffective erythropoiesis releases hemoglobin breakdown products, including bilirubin. The mixture of these two produces the classic lemon-yellow appearance. Patients also develop stomatitis, inflammation of the mouth, and glossitis, which is inflammation of the tongue. Glossitis in this context typically produces a smooth, sore, beefy red tongue because the normal tongue surface papillae are lost due to impaired cell turnover in that rapidly dividing mucosal tissue. In summary, pernicious anemia typically presents insidiously with a combination of hematologic, neurologic, and mucocutaneous symptoms. Most commonly, patients have macrocytic anemia, weakness, pallor, glossitis, beefy red tongue, and may develop neurologic deficits such as paresthesias, impaired proprioception, and gait disturbances. Symptoms may initially be subtle or absent, and neurologic manifestations can precede or occur independently of anemia or macrocytosis. Classic hematologic features include macrocytic anemia with elevated mean corpuscular volume, low reticulocyte count, possible mild thrombocytopenia, leukopenia, and hypersegmented neutrophils on peripheral smear. Characteristic neurologic signs are symmetric paresthesia, especially hands and feet, diminished vibration proprioception, unsteady gait, and in advanced cases, signs of subacute combined degeneration of the spinal cord. Neuropsychiatric symptoms may include depression, memory loss, and delirium. Oral and mucocutaneous findings include glossitis, beefy red tongue, mucosal pallor, angular chelosis, and occasionally mild jaundice or lemon-yellow skin color. Early biochemical derangements include increased methylmalonic acid and homocysteine levels before overt clinical symptoms develop. Failure to treat may result in irreversible neurologic damage. Many cases are initially asymptomatic. Up to 20% of patients with cobalamin deficiency lack anemia, and macrocytosis may also be absent. In the next video, we will discuss the subacute combined degeneration of the spinal cord.